everyone, and welcome to our Plasminogen Deficiency session. My name is Julie, and I work for Paramedic under the Rare Disease Division. We are pleased to have Dr. Shapiro with us today, who will be providing general information about plasminogen deficiency. Dr. Shapiro has many years of experience helping patients dealing with this rare disease. Before we start, we also have another very interesting session today where Dr. Shapiro and her colleagues answer frequently asked questions coming from patients once diagnosed with the disease. You don't want to miss it. I will leave you now with Dr. Shapiro. Thank you very much for your participation, and we hope you'll enjoy this presentation.
Thank you, Julie. Thank you for the opportunity to present congenital plasminogen deficiency, an overview of a very rare disorder. I am Dr. Amy Shapiro. I am Medical Director of the Indiana Hemophilia and Thrombosis Center and a pediatric hematologist. I've been involved in national and international efforts regarding plasminogen deficiency and other rare coagulation disorders. I have a very long-standing interest in plasminogen deficiency, and I'm happy today to present you some information about this disorder. Let's start with an overview of what congenital plasminogen deficiency represents. Plasminogen deficiency is a very rare genetic disorder that occurs when the level of plasminogen, which is one of the enzymes in the clotting pathway that helps break down clots in the body, is absent or very low. As we said, plasminogen deficiency is a genetic disorder in which a person who is affected is born with two genetic changes, one inherited from each parent. This family tree depicts the way in which plasminogen deficiency is inherited. Individuals who are affected with this disorder have a parent, both of which carry a change on the plasminogen gene. When that individual inherits two plasminogen genes, both with changes, they are affected with the disorder. If an individual inherits one gene that's changed and one normal gene, they carry this disorder, as do their parents. If an individual inherits both normal genes, they are unaffected. There are many symptoms that are associated with plasminogen deficiency, and it is important to review these so that they are recognized both by patients, families, and healthcare providers. The common organs that are affected by plasminogen deficiency include the eyes, which is probably the hallmark symptom of this deficiency and is termed ligneous conjunctivitis. However, other systems are affected as well, including the nose, the oropharynx, including the gums and the tonsils, for example, the urinary tract, including the kidneys and the ureters and the bladder, the female genital tract, the ears, respiratory tract, skin, and gastrointestinal tract. Importantly, although not commonly, the central nervous system can be affected as well. The care team for plasminogen deficiency is based upon the types of symptoms that a patient may experience. A hematologist, which is a specialist treating blood diseases, should serve as the pivotal point person for a patient with plasminogen deficiency. Based upon where each affected individual's symptoms present, other subspecialists may be brought into the care team for specific treatment of that area. For example, as we discussed before, the eyes can be a presenting symptom of congenital plasminogen deficiency. Therefore, an ophthalmologist may be a very important person of the care team for an affected individual. However, dental specialists, nephrologists, internists, pediatricians, neurologists, gastroenterologists, urologists, otolaryngologists, and pulmonologists may also be involved based upon where the symptoms of the disease present in any individual. Current treatment options for plasminogen deficiency have been limited. Surgery has been a approach that have been taken in many patients to remove lesions. Although this may provide temporary relief for lesions, the lesions usually return if no specific therapy is provided for the patient to increase the plasminogen level. Steroids have been used, which are anti-inflammatory medications, to help reduce local inflammation and decrease the rate of progression of disease. However, although they may provide some relief, they do not reduce the size of the lesions. Other nonspecific topical treatments have been utilized for plasminogen deficiency. However, again, these do not prevent lesions from recurring. They do not prevent the occurrence of lesions in other parts of the body. Fresh frozen plasma has been utilized as a way to increase plasminogen levels in patients with plasminogen deficiency. Plasminogen is present in fresh frozen plasma. However, the concentration is quite low, and it may require a significant volume for each patient and repeated infusions to maintain a level to help the patient resolve lesions. Therefore, fresh frozen plasma, although useful, is not an optimal therapy. As you can see from this information, current options for therapy are quite limited and not optimal for patient care. We look forward to the development of a specific replacement factor for plasminogen deficiency. Having a specific replacement factor that is present in a concentrated form will increase the circulating level of plasminogen for patients in their blood. By doing this, all systems that are affected can be adequately treated in patients and help resolve their lesions. Thank you very much for your attention to this webinar, and we look forward to a future that is brighter for patients with plasminogen deficiency.